Hi, it's Kate. So today I want to talk a little bit about some self-massage and stretching that you can do for your forearms and wrists. So we all have a tendency to overuse our hands and our thumbs and our wrists and all of these things because of modern day technology and laptops and cell phones and texting and all of these things. So today I just want to go over some techniques. We have a lot of muscles and tendons that kind of run through our forearms that cause a lot of different injuries and discomforts that can happen. So a couple that you might have heard of or know about. For starters, a lot of you have heard of golfer's elbow or tennis elbow. So, and then most of you have also heard of carpal tunnel syndrome. So with that, what happens is the tendons that come off of the muscles in the forearms become inflamed, and that causes some pain and discomfort. So the term tendinitis just means that the tendon that attaches to the muscle and the muscle to the bone has become inflamed. So with tennis elbow, it's the forearm extensors, the ones that are on the top. All of that gets tight and restricted through here, and it starts to cause some inflammation right in this area, so there's pain there. And golfer's elbow is exactly the same, but on the opposite side of the arm, you have a common tendon. So all these tendons come here, and they become one tendon together, one common tendon, and that's the tendon that creates golfer's elbow. Not fun, very painful. And with carpal tunnel syndrome, you have a slew of muscles that turn into tendons, and then they all kind of get really close together and pass through this teeny tiny tunnel called the carpal tunnel. And in the middle of that tunnel, you have your median nerve. So if you've got any type of inflammation in any of those tendons, or all of those tendons for that matter, then what happens is all of those tendons that space gets really, really tight, and so all of those tendons kind of press down on that poor little median nerve that's sitting in the middle. And so that nerve is what innervates, hands and fingers, and so you start to feel what's called neuropathies, which is things like sharp shooting pain, numbness, tingling, burning sensation. Those are all considered neuropathies that you would possibly feel when all of those tendons are starting to press down on that nerve. Now, as a rule, inflammation is not a bad thing. Inflammation is actually the first step in the healing process. So if you've had an injury, a tear, some small thing that's happened, or large thing for that matter, what happens is, in order for your body to heal that area, what'll happen is it'll quarantine that area off, kind of like what we're doing now. It'll quarantine that area off, and then it works things out, it figures out what needs to be healed, and then new, fresh blood rushes into that area, causing it to become inflamed. And then once everything is healed and nice, it flushes out all of the old tissue and old debris that doesn't need to be there anymore, so that new, fresh blood can come in and everything kind of goes back to its normal functioning itself. But if you continue to do the same movement, the same activity, the same thing that caused the injury in the first place, so your body has now created this inflammatory response, then it's trying to deal with this inflammatory response, and you continue to do the same activity over and over and over again, then you end up having what's called chronic inflammation, because your body's never able to actually heal that area and flush out all the old debris and allow that inflammatory response to go down. So, and that's what happens with golfer's elbow, tennis elbow, and carpal tunnel syndrome. So, for today, I'm going to give you a few easy techniques to work on those muscles of the forearm to help you to work through some of this restriction and tension. So, for today, I'm just going to use my knee, but you can use a table, you can use a desk, you can use any kind of flat surface to allow your arm to sit down on. I am also today going to use this lotion. It's Zen Organics, which is what I use for massage therapy in my office. It's an amazing, amazing product. These people are awesome. But you can, for the sake of the fact that, you can't get this just randomly, and you have to order it. For now, you can use any creams, lotions, whatever you have kind of lying around the house. Now, I'm using a very teeny tiny amount, because you don't want to kind of overwhelm your work area with cream. It's just to cause a little bit of a glide. You want to still have a little bit of traction. So laying your arm on the flat surface, you're going to take the other arm, bring it across, and just start to, with your forearm, just push through the top of the arm. Just a nice, easy glide, nice and slow. You may find that there's some areas along the way that are really tense and tight. Take a little time to let that glide through. You're going to do the opposite side, so nice, easy flow. Your hands are going to want to close, that's fine. That's all those muscles. When you press down on those muscles, they start to close. Yes. So once you've done a few different passes, maybe like 4 or 5 passes like this, you can go back and get the elbow in there and do a little bit of friction on those areas that you found tight. So getting in there and really allowing some back and forth friction. If you find a point, hold on to it, especially if you're getting some referral. And then, once you've done all of that, using your hand, your opposite hand, going in the space between the elbow and the crease of the elbow, getting in here, finding a nice little chunk of the muscle to pick up, and just press your fingers straight down into it, and then do some nice wrist twisting. And you can kind of play with where this working hand is. Going through the whole muscle that way. And then it's a little difficult to do the opposite side, so I like to use a thumb and just kind of do some back and forth friction. And again, I'm placing my thumb there and I'm twisting the arm. I'm not using this to do all the work. I'm twisting this arm. Playing with that. Make sure you do both sides, because if you're using your thumb on one side, you're going to want to work those muscles out on that side when you're done with it. Then once you've gotten through all of this nice twisting and working through those different restrictions in those muscles, you're just kind of like separating the muscles, just getting them kind of moving by themselves as opposed to becoming like a big clump, which is what they basically are, but you want them to work freely of each other. So now once you've done all of that, then doing a nice stretch where you drop the wrist down and you just press this wrist down. Let that stretch out. And then you're going to flip the wrist and do it the other way. And again, both sides. So flexing the wrist down and going the other way. You can even do a nice little flip of the wrist this way and this way. If any of this is too much, if you have, a history of carpal tunnel syndrome, or if there's any pain or neuropathies that you're feeling with this, avoid doing the stretching that bothers it and maybe just work the forearms, because sometimes when you're dealing with carpal tunnel, this can actually activate the neuropathy response. So, in that case, maybe just do some nice gentle kind of wrist shakes. With this stretch, you can also do a stretch. I know it's kind of hard to see me right now. Let me do it this way. You can also do a stretch where you're, say, on a table and you just press down and go the other way. So that you're really allowing that. And again, nice straight elbow. Don't let this get too hiked up. Relax this. And there it is. So, forearms and wrists. When you're done, give them a little shake. Just let the blood flow a little bit better. And that's it. All right. Have a good one. Be well.